Hi, everybody. Thank you for tuning in for the first episode. So, Embracing Endings is going to be doing a YouTube channel. We're going to be posting videos here. So, this is going to be for information that you can gain on different industry providers to use as an educational tool. And again, this is purely just informational. If you do need any type of advice or guidance, that would be legal, medical, or financial, we can connect you to those individuals, but do not use this as your source for diagnosing those things. So today we have Laura Rudensky from COHME Home Care. Thank you for being here with us today. I'm really excited about the conversation for today. And I also would love to dive a little bit deeper too into how you guys are super unique because you're a nonprofit. So clients can find you for free, which I think is so amazing, especially within Manhattan and the boroughs. And we all know living here, the prices having something like that for a service is great.
Yeah, yeah. So really the difference is that we have a nonprofit mission of supporting the direct care staff, which I think really enhances both retention of that staff as well as their commitment. Because we are have giving scholarships to them, giving retirement plans and additional support, as well as training. So that really has been a great model. We've been in business since 1984. So obviously there is something to,
Something's working.
yes, yes. So thank you. Yeah.
So I'm curious if you could kind of help explain a little bit. What would you say are sort of the most important parts to home health care that families should maybe be mindful of or be aware of?
Yeah. So well, especially given the expense right now involved in hiring home care services, I think a lot of people are now looking at private care, both for reasons of price as well as the control. And if you have someone saying, "Yeah, I use this person," you can really trust them. That is something that people go towards, of course. But there are some pitfalls involved, whereby I think it really is beneficial for people to consider, even if they are making use of some private care, of getting an agency involved, at least for some of the shifts, say weekend shifts or something hard to cover overnight. Because with the agency, it's above board, so payroll taxes, Social Security are covered. There's liability insurance. This is a really vulnerable population. It's very easy for workers to get injured. So it's very important to have that backup. And then really the aides are trained and supervised by nurses. And that means that the nurse is saying to them, these are signs and symptoms to watch out for, report to me, or this is how to do this kind of transfer with the body mechanics or this task, or with Parkinson's, this is what you're going to see. So I think those are really important.
Definitely. Yeah. And I was going to say the Parkinson's piece really speaks to me personally, just because my mom has Parkinson's. So I think that having that additional educational piece can really be all the difference, just because it's going the extra step rather than just having sort of like an aide show up, kind of do their job, and then they leave. And then when they leave, the family might be in a place of what are we supposed to even be doing or watching out for now? So it really kind of helps to ease the mind a little bit there.
Yeah, and one other thing is just having the ability to get a backup aide, right? The aide calls at 8 a.m. and says, "I'm sick, I can't come in this morning." Um, and that 24-hour on-call service to be able to rely on, or even the aides out for Christmas and Thanksgiving. I have a couple
Yeah.
of clients who kind of use us on just on weekends, and then we hear from
Yeah.
them every holiday.
Yeah, no, absolutely. It's definitely nice to kind of have that little extra security network in your back pocket. So as far as for some misleading things that could potentially present themselves in this industry, what
So
have you come across from just kind of your professional opinion that it might be helpful for any individuals that are currently receiving home health care or thinking about home health care for a loved one, maybe that they should watch out for?
Yeah, and I don't think it's purposefully misleading at all, but I know even for myself, I sometimes when I'm looking on websites, I'm confused sometimes as to when it's companion care versus
Mm.
licensed home care agencies. And again, the difference being that with licensed home care, the aides are able to provide hands-on care, meaning dressing, bathing, grooming, taking vital signs. Whereas with companion care, there should not be that hands-on piece. They wouldn't be able to help them with toileting or other things, but it's not so clear sometimes when you're looking at different agencies' websites, whether they're licensed or not. So that's important to consider. I think live-in services, really important, both from an agency perspective, but even when hiring privately. With live-in, again, the aides are supposed to be sleeping.
Okay.
So from a private perspective, even like if someone's hearing that, the aide was up every couple of hours because there were GI problems or whatever, it's important to take into consideration then how well are they going to be able to function and really do the job. But with live-in from agencies, there's been a lot of court cases around it because again, sometimes the aides are depending upon the state, and this is certainly true in New York State. Their compensation is for 13 of the 24 hours.
Okay.
So some people don't realize that if there is a night, and just as an example, we just took on a case this week. And first night back from the hospital, there were problems, where the person was getting up every couple of hours. So we had explained to them from the beginning, but we had to go back and say, so now we're going to be billing and paying the aide for those hours of sleep that she missed that night. So sometimes people are like, wait, why am I now suddenly getting charged, hourly? So that's very important to take into consideration.
Definitely. So I'm curious about that for a second. So you're saying then for an aide, they would have to be like they are guaranteed pay for that specific amount of time then in New York if they're doing?
If they are not getting 5 continuous hours of sleep and 8 hours sleep total. So it's fine,
Interesting.
someone waking up one or two times to go to the bathroom, but if they're really, waking up
Of
every two to
course.
3 hours, then there needs to be compensation for the sleep time.
Definitely. And I think that that's also really good for people to know as well, just because if someone is just coming back from the hospital, it is a transitional period. And like you, sometimes in certain cases, you can't control what's happening. So, I mean, what are you supposed to do? Be like, okay, sorry, can you please just hold that, whatever's happening here until 9 o'clock tomorrow morning when my shift starts. So that is absolutely something for people to be aware of. And I think that that's great
Yeah, and one other
information.
pitfall I see is people not taking into consideration the medication administration piece when they're
Okay.
dealing with agencies. And this goes for a Medicare agency, Medicaid, as well as any licensed agency. The aides can do medication reminders, so they can even put meds into someone's hand as long as the person can themselves, give themselves the meds, but they can't do injections. They can't even do medicated creams.
Interesting. Okay.
Yeah, so that's an important one also just to be aware of.
And is that just in New York or is that across the
And
board?
so that is different in different states,
Okay.
how that plays out. And New York the legislature has tried to address it at
Mhm.
times, but not completely successfully in terms of having more training for certain aides and advanced aid training so that they would be able to do that.
Okay. Great. And then I'm also curious if, let's say, a family finds themselves in a situation, how would they really be able to kind of distinguish the type of care that might potentially be needed, where it would maybe be like the home health care, maybe the live-in, maybe some other type of continued care? Are there any kind of parameters that would be a little bit easier for someone to remember before they kind of go on this wild goose chase and potentially spend a lot of money with potentially agencies that are not actually fitting the needs that they are looking for specifically in that moment?
Yeah, so I mean, I think home care is often a good place to start, both because it can be temporary. One can try it. It could be gradual, right? Starting with small hours and then upping it. Also, a lot of times one starts anyways with the Medicare home care, right? And then sort of knows from there. But it's not for everyone. I mean, we just had a case. We successfully serviced 24/7 for like the past 4 years. But
Mhm.
there was progressing dementia for the husband
Right.
and more concerns about wandering, as well as falls, for the wife. So that they just moved into an assisted living.
Okay.
It's a hard, not an easy transition either, but
Mhm.
it really we could see that it wasn't, the aides can't be gatekeepers to keep someone,
Sure.
leaving every time. It also really depends. Are there local emergency backups, right? And how available are those backup people? That's going to be a factor as well. And then for some people, like I have a family member who I know she would not be able to tolerate someone with her 24/7. She also, yeah, was able to I mean, she had started with some home care, but realized that what was going to be a better fit for her, because she has been having more falls, was to be able to be in a community where she would be able to call someone if needed. But so many people value so much being in their own environment and
Mhm.
staying in their home and having that familiarity. And it's crucial, right? Sometimes when people have dementia, to put them somewhere else is going to just like disrupt their world, right? I mean, it disrupts everyone's, but particularly for those people. So I really do encourage starting with home care and seeing how it goes, and yeah, and what the best fit is.
Definitely. Well, I mean, I think that that was a lot of great information. Thank you so much for coming on today. And then also too, I am going to put, the contact information as well in the link, but what is the easiest way for individuals that might be in Manhattan or in some of the boroughs to be able to find information for?
Yes, so our website is COHME, COHME.org. But in addition, you can call 212-514-7147, and get us. And once we speak, I usually give out my cell phone also. And again, we are 24/7, so it's possible to call anytime in terms of looking into services.
That's
So
great.
yeah.
It's really wonderful. Well, thank you again for being here today. And thank you all for tuning in for this episode. We will see you on the next one.